If you are over 70 and your legs feel heavy, cold, numb, or constantly tired, I need you to stop everything you are doing right now and watch this video completely. Because what is happening inside your legs right now is not just normal aging. Your blood vessels are narrowing, your circulation is slowing down, and the oxygen and nutrients that your leg muscles, your nerves, and your peripheral tissues desperately need are not getting through the way they used to. But here is what nobody is telling you. There is not just one, there are two specific vitamins that have been shown in peer-reviewed clinical research to dramatically improve blood flow in the legs of adults over 70. Not marginally, not slightly, dramatically. And the overwhelming majority of Americans over 70 are severely deficient in both of them right now, today, without even knowing it. Today, I am going to tell you exactly what these two vitamins are, exactly how they work together, and exactly how to take them correctly for maximum results. And before we go any further, if you have a parent, a grandparent, a neighbor, or anyone in your life who is over 70 and complaining about cold feet, heavy legs, swollen ankles, or nighttime leg cramps, pause this video right now and send it to them immediately. Because what we are about to share could genuinely change the quality of their life starting today. And if you are not subscribed yet, hit that subscribe button right now, because every single week we bring you honest, research-backed, and life-changing senior health information that your doctor probably never had time to explain. Now let us get deep into this, because your legs have been waiting for this information for a long time. Let us start by understanding exactly what happens to blood circulation in your legs after the age of 70, because once you understand the biology of what is going wrong, the solution makes complete and perfect sense. After 70, your cardiovascular system goes through profound and accelerating changes that directly compromise the blood flow to your lower extremities. Your heart muscle becomes less efficient at pumping blood against the increased resistance of aging, stiffened arteries. Your arterial walls, which should be flexible, elastic, and responsive, become rigid and calcified, losing their ability to dilate and contract in response to your body's changing needs. The endothelial cells that line the inside of your blood vessels, which are responsible for producing nitric oxide, the molecule that signals your blood vessels to relax and open up, become progressively less efficient at this critical function. The result of all of these changes is that blood flow to your legs, particularly to the small peripheral blood vessels in your feet, calves, and ankles, slows to a fraction of what it was in your younger years. Your leg muscles receive less oxygen. Your peripheral nerves receive fewer nutrients. Waste products like lactic acid accumulate in your leg tissues instead of being efficiently cleared away. And inflammatory compounds that your aging liver and kidneys are less able to neutralize begin to deposit in the walls of your leg arteries, making them stiffer, narrower, and even less able to carry adequate blood flow over time. This is a progressive, compounding cycle, and without specific nutritional intervention, it gets worse every single year. Now here's what makes this situation both serious and genuinely hopeful at the same time. The two primary biological mechanisms driving poor leg circulation after 70, vascular rigidity and endothelial dysfunction, are both directly and powerfully addressed by the two vitamins we are going to discuss today: niacin, which is vitamin B3, and high-dose vitamin C. These two nutrients work through completely different but beautifully complementary mechanisms, and together they create what vascular researchers call a synergistic circulatory restoration effect that is far more powerful than either vitamin alone. Let us go through each one in detail. 1. The first vitamin is niacin, also known as vitamin B3. And when it comes to improving blood flow in the legs of adults over 70, nothing in the over-the-counter supplement world comes close to what niacin can do. Niacin is often called nature's most powerful vasodilator, and that title is completely earned. A vasodilator is any substance that causes your blood vessels to widen and relax, allowing more blood to flow through them. Most vasodilators work indirectly, through hormonal pathways or enzyme inhibition, but niacin works directly on the smooth muscle cells in your blood vessel walls, causing them to relax and dilate almost immediately. The result is a dramatic increase in blood flow through your arteries and capillaries, including the peripheral vessels in your legs and feet that are most affected by age-related circulatory decline. But niacin does far more than simply dilate blood vessels in the short term. It has profound long-term effects on vascular health that make it one of the most comprehensively beneficial nutrients for cardiovascular and circulatory function, available without a prescription. Niacin is one of the most powerful natural agents known to science for raising HDL cholesterol, the good cholesterol that helps clear arterial plaque and keeps your blood vessels clean and open. Multiple landmark clinical trials have demonstrated that niacin raises HDL levels by 20 to 35%, a result that no other over-the-counter supplement can match. Higher HDL levels mean cleaner arteries, better blood flow, and significantly reduced risk of the arterial blockages that cause peripheral artery disease and dramatically worsen leg circulation in older adults. Niacin also powerfully reduces triglycerides, the blood fats that contribute to arterial inflammation and plaque buildup, by 20 to 50% with consistent use. And it reduces levels of lipoprotein A, a particularly dangerous blood fat that is strongly associated with arterial disease and that most other cholesterol interventions do not adequately address. Together, these effects on blood lipids create a cleaner, more open arterial environment that directly improves the volume and quality of blood reaching your legs with every single heartbeat. There is one important thing to know about taking niacin, particularly the immediate release form. Most people experience what is called the niacin flush, a temporary sensation of warmth, redness, and tingling in the skin, particularly in the face, neck, and chest, that occurs 15 to 30 minutes after taking niacin and typically lasts 20 to 45 minutes. This flushing response is completely harmless. It is actually a direct result of the blood vessel dilation that makes niacin so effective, but it can be alarming if you are not expecting it. Taking niacin with food, taking a regular strength aspirin 30 minutes before your niacin dose, and starting with a lower dose of 100 to 250 milligrams and gradually increasing over several weeks, all significantly reduce the intensity of the flush. There is also a no-flush niacin form called inositol hexanocatenate, but it is important to know that the evidence for its circulatory benefits is significantly weaker than for standard immediate-release niacin. For maximum blood flow benefits in the legs, immediate-release niacin remains the gold standard. The recommended approach for adults over 70 seeking improved leg circulation is to start with 100 milligrams of immediate-release niacin with dinner and increase by 100 milligrams every 1 to 2 weeks as tolerated, working toward a target dose of 500 to 1,000 milligrams daily. Always consult your physician before starting niacin, particularly if you are managing diabetes, liver conditions, or gout, as niacin can affect blood sugar levels and uric acid metabolism. The second vitamin is high-dose vitamin C, and its role in leg circulation after 70 is both profound and tragically underappreciated. Most people think of vitamin C as simply an immune booster, something you take when you feel a cold coming on. But at therapeutic doses, vitamin C is one of the most powerful vascular restoration nutrients known to science. Here is why. Vitamin C is the essential cofactor for the synthesis of collagen, the primary structural protein in your blood vessel walls. Without adequate vitamin C, your arteries and capillaries literally cannot maintain their structural integrity. The collagen matrix that gives your blood vessel walls their strength, elasticity, and impermeability begins to break down. This leads to vessel wall fragility, increased inflammation, impaired blood flow regulation, and the kind of progressive arterial deterioration that significantly worsens circulation in the legs of older adults. But vitamin C does even more than support structural integrity. It is one of the most powerful stimulants of endothelial nitric oxide synthase, the enzyme responsible for producing nitric oxide in the endothelial cells of your blood vessels. Remember nitric oxide, the molecule that signals your blood vessels to relax and dilate? Vitamin C directly stimulates more of it to be produced. Multiple clinical studies have demonstrated that high-dose vitamin C supplementation significantly improves endothelial function, the ability of blood vessel walls to produce nitric oxide and respond to circulatory demands, in older adults with compromised circulation. A landmark study published in the journal Circulation found that intravenous vitamin C dramatically improved blood flow in patients with coronary artery disease by restoring endothelial function. While oral supplementation does not achieve the same blood levels as intravenous administration, consistent high-dose oral vitamin C has been shown in multiple studies to produce meaningful improvements in endothelial function and peripheral blood flow in older adults. Vitamin C is also one of the most powerful antioxidants in your body. And oxidative stress is one of the primary drivers of the endothelial dysfunction and arterial inflammation that compromises leg circulation after 70. By neutralizing the free radicals and reactive oxygen species that damage your blood vessel walls and impair their function, high-dose vitamin C protects your vascular system from the inside at the cellular level, creating an environment where blood can flow more freely and more efficiently to every part of your body, including your legs and feet. The recommended dose for circulatory benefits in adults over 70 is 1,000 to 2,000 milligrams of vitamin C daily, divided into 2 doses of 500 to 1,000 milligrams taken morning and evening with food. Look for vitamin C in the form of sodium ascorbate or calcium ascorbate rather than plain ascorbic acid. These buffered forms are significantly gentler on the stomach and better tolerated at higher doses. Start at 500 milligrams daily and gradually increase to your target dose over 2 to 3 weeks to minimize any digestive discomfort. Now, I want to stop right here and share a story with you, because everything we have been discussing becomes so much more meaningful and real when you see it changing an actual person's life. Tommy is a 74-year-old retired postal worker from Phoenix, Arizona. He spent 35 years on his feet walking delivery routes in the Arizona heat, and by the time he retired, his legs were paying the price. His feet were constantly cold even in the 110-degree Phoenix summers, which his wife found completely baffling. His ankles swelled every single afternoon without fail. The skin on his lower legs had taken on a dark mottled appearance that his doctor told him was a sign of poor venous circulation. He experienced severe nighttime leg cramps at least 4 times a week that woke him up in agony. And that familiar, heavy, lead-like feeling in his legs every morning meant that getting out of bed and starting his day had become something he genuinely dreaded rather than something he looked forward to. Tommy had seen his primary care physician about his leg circulation concerns 3 separate times over 2 years. Each time he was told that his circulation was age-appropriate for a 74-year-old and that there was not much to be done beyond staying hydrated, wearing compression stockings, and keeping moving. Tommy followed all of this advice faithfully. He wore his compression stockings every single day, he walked as much as his legs would allow, he drank water consistently, and while the compression stockings helped somewhat with the swelling, the coldness, the cramping, and the heaviness never improved at all. Then, Tommy's son, who had been doing extensive research on natural approaches to circulatory health in older adults, came across the clinical research on niacin and high-dose vitamin C for peripheral circulation. He put together a simple supplement protocol for his father and sat down with him to explain exactly what each vitamin did and why the combination was so powerful. Tommy was skeptical. He was a practical, no-nonsense man who had not historically been interested in supplements. But he trusted his son, and his legs were bad enough that he was willing to try anything. He started niacin at 100 milligrams with dinner the first week. The first time he flushed, he called his son in a mild panic. The warmth and redness spreading across his face and chest startled him. His son reassured him it was completely normal and actually a sign the niacin was working. By the second week, Tommy was already less bothered by the flush and had increased to 200 milligrams. He also began taking 500 milligrams of buffered vitamin C twice daily, with breakfast and with dinner. By the end of week 3, something remarkable began to happen. His wife noticed it first. His feet were warm when they sat together watching television in the evening, not just less cold, actually warm. She had not felt warm feet on Tommy in over 3 years. Tommy himself noticed that the afternoon ankle swelling, and which had been as reliable as clockwork every single day for years, was significantly less pronounced. By the end of week 6, the nighttime leg cramps had reduced from 4 to 5 times per week to once, sometimes twice per week, and that heavy morning feeling in his legs, the one that made getting out of bed feel like a punishment, had lightened noticeably. Tommy told his son during a phone call at the end of week 8 that his legs felt more like his legs again. He had started taking his evening walks without the heaviness and coldness that used to make every step feel like an effort. His wife told their neighbors that her husband had a new lease on life and that 2 vitamins had done what 3 doctors could not. Tommy continues his niacin and vitamin C protocol every single day and recently told his son that it is the most important health decision he has made since retirement. He has since shared the protocol with 3 of his neighbors over 70 who were dealing with similar leg circulation issues, and all 3 have reported meaningful improvements within the first 4 to 6 weeks. Now let us talk about how to combine these 2 vitamins into a simple, practical daily protocol that you can start implementing right away. In the morning, Take 500 to 1,000 milligrams of buffered vitamin C, sodium ascorbate, or calcium ascorbate with your breakfast. This gives your body a sustained supply of this critical vascular nutrient throughout the morning hours when your circulation is most active. In the evening with dinner, take your niacin dose, starting at 100 milligrams and gradually increasing as tolerated, along with your second dose of 500 to 1,000 milligrams of vitamin C. Taking niacin with food significantly reduces the intensity of the flush, and taking it with vitamin C creates that synergistic circulatory effect. The niacin dilating your blood vessels while the vitamin C stimulates nitric oxide production and protects your vessel walls simultaneously. This 1-2 combination at dinner means that your circulatory system receives its most powerful nutritional support during the overnight hours when your body is in its primary repair and regeneration mode. To maximize the results of this protocol even further, pair it with these additional daily habits. Walk for at least 15 to 20 minutes every morning. Even gentle walking at a comfortable pace significantly stimulates peripheral circulation and helps the nutrients from your supplements reach your leg tissues more effectively. Stay consistently hydrated throughout the day. Aim for 8 to 10 glasses of water daily because adequate hydration is essential for maintaining healthy blood viscosity and ensuring efficient circulation. Elevate your legs for 20 minutes each evening before bed to improve venous return and reduce the ankle swelling that poor circulation causes. And eat a diet rich in foods that naturally support nitric oxide production, particularly beets, leafy greens like spinach and arugula, garlic, and citrus fruits, which further complement the circulatory benefits of your niacin and vitamin C protocol. The bottom line is this: cold feet, heavy legs, swollen ankles, nighttime cramping, and that persistent heaviness in your lower extremities after 70 are not sentences you have to live with permanently. They are signals from a circulatory system that is not getting the specific nutritional support it desperately needs. Niacin and high-dose vitamin C, working together through their complementary mechanisms of direct vasodilation, nitric oxide stimulation, arterial cleanup, and vascular wall restoration, address the root causes of poor leg circulation at the cellular level in ways that no compression stocking, no amount of hydration, and no generic lifestyle advice ever can. Tommy discovered this at 74, and it changed everything about how his legs feel, how he moves, and how he experiences every single day of his retirement. The same is possible for you. Start today. Talk to your doctor. Get the right forms of these vitamins. Start at the right doses. Be consistent every single day. And pay attention to how your legs begin to feel over the coming weeks, because the changes that niacin and vitamin C can produce in your leg circulation after 70 have the potential to be among the most meaningful health improvements you experience in this decade of your life. Now, before you go, drop a comment below right now and tell me your age and the city you are watching from. And tell me, are you currently dealing with poor leg circulation, cold feet, or swollen ankles? Have you ever tried niacin or high-dose vitamin C before? I want to hear your story. I read every single comment personally, and this community is the reason this channel exists. And if this video gave you something valuable, if it gave you real hope and a real plan, please share it right now with someone over 70 who needs to hear this. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Take care of your circulation, because strong blood flow is the foundation of everything. This video is intended for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information shared is based on publicly available scientific research, peer-reviewed clinical studies, and general wellness and nutritional information available at the time of recording. The patient story featuring Tommy has been included for illustrative purposes only and reflects experiences consistent with existing clinical research on niacin and vitamin C for circulatory health. Individual results will always vary significantly based on age, overall health, underlying medical conditions, current medications, and other personal factors. Niacin and high-dose vitamin C may interact with certain medications and health conditions. Niacin can affect blood sugar levels in diabetic patients, may affect liver enzyme levels at higher doses, and can interact with blood-thinning medications and statins. High-dose vitamin C may affect kidney stone risk in susceptible individuals. Always consult with a board-certified physician, cardiologist, or other qualified licensed healthcare professional before starting any new supplement protocol, especially if you are over 70 and managing existing health conditions or taking prescription medications. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the United States Food and Drug Administration. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease or medical condition. Never disregard professional medical advice or delay seeking appropriate medical care because of content you have watched online. Viewer discretion is always advised.